when I've heard you talk about 4 stages, right? So the normal glucose tolerance, the pre-diabetes, the clinical diabetes, and then of course complications, which you talked about. So this phenomenon that you described, does it start in the normal glucose?
Yes, so it actually happens before NGT also. So, I mean, somebody may feel that my sugar is absolutely normal. That does not mean he is absolutely normal. As I told you, who should be the normal, to whom you have to consider, whose abdominal girth is not more than half of his height or her height. That is what you can say, that he is more or less perfectly all right. But still, it may not be true, because here I am not examining the patient clinically. But ideally, if his abdominal girth is not more than half of his height, and doing a good amount of exercise with a muscle strengthening exercise are included, with some abs exercise which he is doing, and taking the food in a moderation, not too much carbs which he is eating, probably he is the normal. But then what happens? We get a one person who is at hyperinsulinemia. We get a person who is centrally obese. We get a person who is at the risk of developing diabetes. We have a Indian diabetes risk score also. People can you can calculate the risk score, that how much chances you are going to have in next 5 year chances of getting development of diabetes in your body. That sort of a risk score can be calculated also. And then comes the persons who are at the risk of diabetes. Then you get the patient with IGT, which is a impaired glucose tolerance. Then you get the person with full frank clinical diabetes. Then somebody develops with diabetes and complication. And then the complication which are also advanced complication along with diabetes. So this is what the different stages of diabetes.